So I'll leave you to it, Giulia. Thank you.
Thank you. So good afternoon, morning, everyone, and thanks, Flo, for the introduction. I'm Giulia Carella. I'm a research scientist at the Barcelona Supercomputing Center. But as Flo mentioned, I previously worked at Carto as a data scientist. And the work that I will present today is a work that I started at Carto together with some of my former colleagues, Javier Perez Trufero, head of data, Miguel Alvarez, who is a data scientist at Carto too, and Professor Jorge Mateo from University Jaume I in Spain. In this work, we looked at how human mobility changes during the COVID-19 US epidemic depended on socioeconomic inequality. So the outbreak of the COVID-19 virus led to an unprecedented health and economic global crisis, and the United States have become one of the main epicenters of this pandemic. As the virus spreads across the globe, it appears to be setting off a devastating feedback loop with another of the gravest forces of our time, economic inequality. At the same time, inequality itself may be acting as a multiplier of the virus spread and deadliness. For example, two major risk factors are thought to make this virus deadlier, as old age and pre-existing conditions. But a growing body of research has identified a third factor, low socioeconomic status, that, for example, might be related to higher rates of chronic health conditions such as diabetes or heart disease, but also to the adoption of self-protective behaviors, for example, following the authorities' stay-at-home recommendations, and risk awareness. In this work, we looked at the interconnection between risk, social distancing, and mobility. Mobility directly affects social distancing, which is a key factor in the pandemic response. So the question here is how well different sections of the society are likely to react to non-pharmaceutical interventions, or NPIs for short, strategies. Some other work has been done in this direction. For example, a recent study in the US looked at the association between income and changes in mobility after the state of emergency declarations, and found that wealthier counties decreased their mobility significantly more than poorer counties. Another study that used instead only some survey data, I think it was a 1,000 individual sample, looked at more dimensions of inequality, not just income, again in the US, and found that there was a positive association between self-protective behaviors with income, flexible work arrangements, and outside space at home. Similarly, using Facebook data, another study found stronger reduction in mobility in Italian municipalities that had a higher fiscal capacity, but also where inequality is higher. So why do we need another study? Well, the studies that I've mentioned, either they look at only one dimension of inequality, for example, income, or only uses some small sample of data, for example, from surveys. While in the US, we couldn't find a study that looked at multiple dimensions together and across the whole country. But also, I think it's important to consider the temporal dimension. The epidemic is evolving, and we are interested in understanding if the association between changes in mobility and the underlying socioeconomic characteristics evolves with time. So which data sources can we use to look at this problem? Well, first of all, we need socioeconomic, demographic, business attributes that are available in the US from the US Census. These data are then pre-processed and refined in a way from several providers. For example, one is Applied Geographic Solutions, which is one of Carto's partner. They are available at the finest support at the block group level. But here in this study, we use the data aggregated at the county level in order to match the spatial support of the other data sources. We also need some epidemiological data as a proxy of risk awareness. These again are available at the county level in the US. And then we need to choose the right mobility indicator. During the last month, several providers, including Google, Facebook, and SafeGraph, have made available different mobility metrics. Ideally, the selected metrics should have good representativeness, but also should be available relative to a pre-pandemic baseline, but also in absolute terms in order to be able to better compare pre and post-pandemic conditions. In reality, we need to compromise. And for this particular study, in order to capture the response of different sections of the society to MPI strategies, we selected as the mobility exposure of interest, the changes in workplaces mobility, which is defined as the number of devices at workplaces and is provided by Google at the county level. In this slide here, you can see the percentage change in workplaces mobility from Google for a random selection of US counties. The raw data are shown in blue, and 7 days running mean is shown in orange. You can also see overlaid the US median. Clearly, we can see that after the national emergency was declared on March 13th, there has been a sudden drop in workplaces mobility that reached a minimum around mid-April, and then the mobility started recovering again. Later on, we can see other drops that are related to national holidays like Memorial Day or Independence Day. But what is important here is that we can see that there is a high heterogeneity in the response to MPI strategies between different counties. There are counties that reduced their mobility only up to 20%, but others reduced their mobility more than 50%. So what we are asking here is how much of this variability can be explained by socioeconomic attributes, and what about the rest of the variability? Also, what we're interested here in is how this the strength of this association has evolved over time. So do we expect the link between changes in mobility and the underlying socioeconomic attributes to evolve during the epidemic? To answer these questions, we started by defining 2 different phases that we call the lockdown and recovery phase. The lockdown phase is identified as the phase up to April 13th, which is the day where the US median for the percentage change in workplaces mobility reaches the minimum. And the following phase is identified as what we call the recovery phase, when the mobility started increasing again. For each phase, we defined as the variable that we want to model the difference between the maximum and the minimum in workplaces mobility. In this slide here on the top, you can see this y variable for both phases. On the left, for the lockdown, and on the right for the recovery phase. As noted before, we can see a lot of heterogeneity, but also what is striking here is that there is a lot of spatial clustering. The other variable that we had to take into account, because it has some temporal evolution, is the epidemiological covariate that we're going to use in the model. In this case, the epidemiological covariate that we're going to use is the cumulative number of cases per 1,000 people as of the last day of each phase, which is shown in the two maps here at the bottom. So given that we want to model this variable here, can we link the changes in this variable to the underlying socioeconomic, demographic, and business patterns? So the first thing that we want to see, using some kind of preliminary analysis, is if we can actually see any link. Then we, when constructing our model, we need to account for any correlation in the covariates, which we know, especially thinking of the census covariates, is something that is obvious. And then finally, we have to understand how we can deal with any residual spatial variability, if this exists, and how can we use what we see from the model to inform policy evaluation and interventions. If we start looking at some simple plots like this one that shows the percentage change in workplaces mobility for different wealth groups, we can start understanding a bit more the problem. What you see here is the percentage change in workplaces mobility for different wealth groups according to the quantile for the median household income. And as expected, counties that are richer drop their mobility more than poorer counties. However, when the minimum is reached, all the wealth groups progress in a similar way up to the new maximum in the recovery phase. In terms of dealing with the correlations between the US census covariates, we use the principal component analysis approach. Here, we extracted 6 principal constructs from the US census data that explains up to 55% of the variance. These constructs can be related to density of workforce, density of households, household income, median age, density of Hispanic population, and density of multiple race population. And what you see here is the correlation of each construct with the most, with the 5 most correlated variables. In terms of the model that we used to analyze these data, we used a generalized linear model that has a beta likelihood in order to deal with the nature of the response variable, which in the case is bounded between 0 and 1. The linear combination here is given by an intercept term and then a combination of the epidemiological covariates and the principal constructs. We also looked into using a spatial model that can be used to determine if the extra beta variability that is not explained by our fixed effects can be related to neighborhood or proximity effects. For dispersal terms, we used a model that is based on Gaussian Markov random fields. These models are based on neighborhood structures, and the idea is that they can smooth the data according to certain neighborhood structures that specifies that 2 areas are neighbors if they share a common boundary. The specific model that is used to model the spatially structured residual component here is an intrinsic conditional regressive model, ICAR model, which does exactly what I have just said. Here, delta I would be the set of neighbors, and delta I would be the number of neighbors. If we look at the results of these models, sorry, we can see that when we look at the lockdown and the recovery phase, we see two different stories. The rows here in this table refers to the model using only 6 constructs from the US census covariates that explain 55% of the variance, and using 42 covariates for the second row that explains up to 90% of the variance. Here in the columns, you see the results in terms of the pseudo R2 square for the lockdown, the recovery phase, and both the beta and spatial beta model. So we can see that in the lockdown phase, the socioeconomic covariates are able to explain about 40% of the variance, but this drastically drop in the recovery phase. On the other hand, when we add the spatially structured residual term, the model accuracy jumps to about 0.8 for both phases, suggesting a strong proximity effects. We can also look at the signs of the effects. Here you see for each of the first 6 principal constructs that we have identified the corresponding sign for each phase. So we can see that during the lockdown phase, after controlling for the epidemiological situation, because this is another covariate included in the model, we can see larger drops in mobility in counties with higher income, with an older population, with a lower density of Hispanic population, that are less densely populated, but with a larger density of workforce. Larger drops were also associated with areas with a larger density of multiple race population, which mostly correspond to the Native American territory Navajo Nation, which spans part of Arizona, New Mexico, and Utah. And this area was in fact heavily affected by the pandemic and underwent one of the strictest stay-at-home orders in the nation. Sorry. On the other hand, as in the lockdown phase, richer, older, and with a larger density of workforce counties were associated with the largest drop in workplaces mobility. They also experienced a stronger recovery in the following phase, although the magnitude of the effect is highly reduced. Finally, we can have a look at the residual spatial variability that is modeled in the spatial beta model. What you see here are 2 maps showing the posterior mean of the spatial random effect for the lockdown and the recovery phase. Clearly, by adding more census covariates to the model, we were not able to improve drastically the model accuracy, as was shown in a couple of slides earlier. On the other hand, we can ask ourselves, what do we think this spatial residual variability might come from? For example, state and county-wise regulations and their effect on neighboring areas were not accounted for in the model. They are difficult to trace, but local restrictions would induce similar behaviors in nearby counties, and in fact might explain the observed residual spatial dependent structure. If you look at these maps, you can see that in many cases, the spatial clusters identified here corresponds with the state boundaries, for example. So to conclude, the main takeaways of these studies are that in the early stages of the epidemic, county level socioeconomic and demographic and business covariates explain up to 40% of the variance in the changes in workplaces mobility. But when accounting for the residual spatial variability, the variance explained by the model increases to up to 80%, suggesting strong proximity effects. The similar behaviors in nearby counties that are present across the whole period of study might indicate a potential link to state and county-wise regulations. Clearly, this framework cannot detect causal relationships and only correlations, but by trying to link the heterogeneity that we see in the mobility data, the results that we see here can directly help policy evaluation and intervention, which, especially during a state of alert, are often targeted at the community level. So thanks a lot for the attention, and I'll take any question.
Hi, Giulia. Thanks for your talk. We have a couple of questions here. The first one is from Cal Lee, who would like to know, in terms of mobility, is there a difference between daily mobility and more permanent mobility, i.e. moving out of a city?
Yes, so we selected the workplaces mobility because we thought it was the most stable one in pandemic times, because, for example, we did look at another metric that is the percentage of people completely at home. And we saw that this was highly influenced by people moving out of the city. For example, in Manhattan, in New York City, we could see a lot of people that were not at home, but actually because they were in their secondary home somewhere else.
Right.
So you need really to be careful when looking at these metrics, because they change all the time, and especially during exceptional times like these ones.
And just to expand a bit further on the mobility data, we have a question from Sishen Wan, who would like to know how the mobility was measured, like number of trips, distance, time. Could you elaborate a bit more there, Giulia?
Yeah, so this particular metric is measured as the number of visitors at workplaces. So I imagine, although Google doesn't give a lot of details, but I imagine that what they do, they extract the user's home and work location, and they measure how many people are during the day hours at their work. But this is an important point, because all these mobility metrics have been made available, but the information about how the data have been created and aggregated is not always very clear, which is a problem for these kind of studies.
Right. Just as someone in the chat has asked, said it's a really interesting presentation, they'd love to have a copy of it. I think we can share the GitHub link to the code, right, Giulia?
Sure.
Yeah, we'll share that on the chat. Sophie, who asked for the link. And then we have another question here from Luis Jahir Briones Escobedo, who has asked, have you tried extrapolating the data from the last census to get a better R² or a better fit?
No, we haven't. So these are old census data. It's a good idea. Could be something that we could explore.
Fantastic. Cool. And then we have another comment here from Shreya Sanek, who says, what were the mobility observations depending on professions of the people in the study?
Yeah, we don't have this detail in the data that we have, but it is so one of the covariates that we used in the model is related to the business category. So we've included the different type of employees in the model. So it would be office employees and people working in agriculture or industry and so on. But this is something that we have available for the covariates, but not for the mobility.
Right. Okay. Now there's some other questions as well. So Caleb Jenkins has asked, were there any attempts to use mobility as a leading predictor of new cases?
Yes, there have been quite few studies about that. The problem with that is mainly with the data about the new cases, because they depend a lot on the testing strategy. So we were more interested in looking actually at the mobility data, also because we thought this was an easier task, because they are more reliable than cases data,
right?
Especially data from Google.
Yeah, absolutely. Okay, well, there are plenty more questions on the chat, Giulia. Perhaps you can answer them once we wrap up. But thank you so much for preparing this.
Thank you.
Last minute as well. So we really appreciate you doing that. Giulia, could you give the audience a bit of a flavour of what to expect from your workshop tomorrow?
Yeah, sure. So together with Miguel Alvarez, he will actually be leading the workshop. We're gonna go through some of the functions from Carto Frames, which is Carto's Python package to work with spatial data and analysis. And we're gonna look at two different use cases. One is about revenue prediction, and the other one is about optimization for supply chain. And we're gonna show how to access the data and build a spatial model and also understand the results. So tune for the workshop.
Fantastic, cool. Well, I hope lots of you who are here today will join us tomorrow as well. For now, we're gonna say goodbye to Giulia, and we now actually have a short